Good morning, everyone. Athens Limestone Hospital, what we're doing is a little meeting and greeting with doctors, and here with me this morning, not covering up his face, is Dr. Seth Rayburn. How are you?
Hey, I'm good.
Good. What kind of doctor are you?
I'm a general surgeon.
Okay.
I've been here in Athens for about 7 years.
Where did you move from?
Well, we moved from Mobile. My wife and I came here and raised a family here in Athens, and we've really loved it here since we've been here. Now, originally, I'm from a small town in Alabama, from the small town of Fayette, Alabama.
Small town.
Yep, Fayette. So this is one of the reasons that I came up to Athens, because I wanted to get back to the small town atmosphere, and we've really fallen in love with the community since we've been here, and very excited about being here.
That is one thing. Limestone County and surrounding counties are wonderful, especially if you're new to the area. They will make you feel like home. When you were touring the hospital, what enticed you about it? What just stood out? What did you like so much about wanting to be a part of Athens Limestone Hospital?
Well, one of the first things that I noticed was the cleanliness of the hospital and friendliness of the staff. And, you know, for a small hospital, it's very modern. We've got very modern equipment. Of course, I was looking in the surgery department, and I was very impressed with what I found here, and couldn't wait to get started up here.
One of my questions that I have on my notes is about the infection control. We've heard a lot about infection control, and the outcomes at Athens Limestone Hospital are what?
Well, I was asking some people to look up the numbers just before this, and our infection control is very good here. In fact, our infection control for last month was less than 1% surgical infections, so that's better than the national average by quite a bit.
Wow, right here in Limestone County.
Yes, I mean that's actually one of the advantages of being in a small hospital. We do have a very good infection control, and we have a very diligent staff that's always trying to help with that as well.
Now, when you take patients or you accept patients, which you always are, is it more male-based or female or both?
It's about 50-50. It's a mix. I do a wide variety of procedures. General surgery is a very broad scope. Most of the procedures I probably do are intra-abdominal procedures. We do a lot of gallbladders. We do a lot of appendixes and hernias, colon surgery such as diverticulitis, and we do a lot of cancer surgery as well. Colon cancers, breast cancer, skin cancers, and
which are on the rise.
This is true. This is true. We see quite a few skin cancers. We do a lot of endoscopy. That includes colonoscopy and EGDs. That's where you take a scope and look into your throat down into the stomach. And if we find ulcers, then we can certainly operate on that if necessary. And on top of that, we see a lot of patients here at the hospital. We get consultations from other specialties, especially with abdominal pain or diabetic wounds and ulcers. We manage that quite a bit. And also, I do a lot of vascular access surgery. That's surgery for dialysis patients.
Okay, very important there too. I do have one question. I've heard several people say that they've suffered from appendicitis and everything like that. And then you hear everyone saying, oh, if you have a pain in your left side or your right side, what is it you should look for?
Well, for appendicitis, it's on the right side.
On the right side.
On the right side. Pain, especially with movement or tenderness when you touch in that area, could be appendicitis. It usually is more common in younger patients, although I've taken appendixes out of people in their 70s before.
Really?
Not very common, but we do from time to time in the older patients. And I might want to add that we do, most of the surgeries we do here are minimally invasive, like pretty much, larger hospitals. We do have the equipment. We do, almost all of our procedures are minimally invasive, except when it's absolutely necessary. We can certainly do open procedures as well.
And when you say minimally invasive, you're talking about you're going to get that patient in and out and recover quicker?
Yes, with smaller incisions, laparoscopic incisions versus the standard open, larger incisions. And that's really kind of revolutionized surgery in the last 10 to 20 years.
Right. Well, I know we were mentioning the Gala not too long ago. You can be dancing at this year's Gala.
I'll pretty much, I'll be there. I don't know if I'll be dancing as much. I can't even read my notes anyway. But,
that's okay.
But my wife we've been very fortunate to be involved in the community. My wife has been active in the Gala, and she's been doing this for several years, which is also one of the nice things about being in a small town, because I really like to get out and about and see my patients here, not just in the office, but also at Walmart.
Well, I'm glad you said that, because now when you see him at Walmart, you can say, "Hey, Doc, it'll be okay."
I'll be there.
All right. Well, good. Well, thank you so much. Anything you want to throw in here in case we've forgotten? What time do you wake up in the morning?
Well, pretty long days. I usually operate at 7:30, so I get here and see patients in the hospital. Sometimes before that, but we stay as long as it takes in the afternoons as well.
All right. Well, you can call the number on the bottom of the screen to set up an appointment should you need to, and they will take care of you. Yet another doctor we're introducing you to at Athens Limestone Hospital. Thank you.
Thank you very much.
You too.
Local and loving